online and on billboards that other conditions might be more common, but that's just not true. So I'm glad we're paying attention to it today. This is a website from the Mayo Clinic. I just want to show you real quick. This is a list of risk factors that are associated with heart disease. So we see the classics that everyone's familiar with: age, sex. The older we get, the more likely we are. Sex, family history, smoking. But I want to focus on the other ones too. Poor diet, right? Everyone knows, high cholesterol, things like that, salt, sugar, high blood pressure, high cholesterol, diabetes, obesity. So just whether you have high cholesterol or diabetes alone, just having high body mass is a risk factor. Physical inactivity. You're going to hear a lot about that. Stress. So just think about the effects that stress has on the body and how that can actually be a risk factor. So we're going to focus a lot on that. And there's who doesn't have stress? Raise your hand. Anyone? Okay. Didn't think so. Poor hygiene, right? So even bad dental health is a risk factor for heart disease. Okay. Let's get to the meat. I'm going to talk first, and Dave then will talk. Okay, so benefits of a wellness program is just the idea of having a multidisciplinary approach to address issues such as weight management, exercise, or perhaps even stress through counseling or other issues. And that's a wellness program, in addition to what your doctor might do in the office to help with blood pressure and other things. I'm going to talk about the benefits of exercise from lots of aspects on the heart, psychologically. We talked about stress, sleep, and pain, which is actually another risk factor. And then Dave will talk about the benefits of having a wellness program or a structured exercise program. We know that exercise can help with our lean body mass, blood pressure, blood sugar, lipids, and cholesterol. It can improve our endurance, our stamina, less fatigue. It improves our immunity function, our immune system, less depression, less anxiety, improved memory and cognition, coronary disease. Really, the list goes on and on. Lower cancer risk. Lean body mass is your muscle mass. And as we get older, especially after we age, after 50, we lose almost half a pound on a yearly basis. And losing your muscle mass is a big risk factor for falls and losing your function, the ability to navigate up and down the stairs or live safely at home on your own. However, in people over the age of 65, you can actually find improvement of your muscle gain, 2.42 pounds by doing regular exercise. And in essence, the more times you do it, the more days that you exercise, the more muscle you get. And again, that's important for keeping your function, ability to live at home safely and do what you need to do and decrease your risk of falls. Exercise and blood pressure is big. A lot of us think that you have to exercise a long time to get the benefits, right? That's not true. They did a study in elderly women over 65, and all they did was have them lift weights, 3 sets of weightlifting. So what that means is, if you do a bench press and you bench it 10 times, take a break and do that another time. Take a break, do that another time. That's 3 sets of weight training. When they did that and they had the women press weight about half of what they could, right? So not even that much. What we would call mild to moderate exercise. They found that their blood pressure actually dropped for at least an hour after doing just that little bit of exercise. Just one session of exercise, and you're able to lower your blood pressure by about 12%, okay? So you don't have to do a lot for a long time to get the benefits. You can get it immediately. And it was safe. It didn't hurt their heart. We know that cholesterol and blood sugar are risk factors for heart disease. And so in this study, they took obese men or men that didn't exercise, and they had them cycle for about 6 weeks, use an exercise bike. And they had them do either high intensity interval training, I'll explain what that is, or moderate intensity training. Moderate intensity training is what you think of if you're going to get on your bike and you're going to bike around your neighborhood for an hour, right? That's moderate intensity. They had those guys do it for about 5 hours a week, so that's 1 hour a day for 5 days a week. And the high intensity interval training group, this is interesting. They just had them exercise for 20 minutes, really exercise really hard, so that they were out of breath and couldn't really catch their breath. But for 20 minutes, and they do that 3 days a week, so just a total of 1 hour of exercise a week. And they were able to lower their blood sugar and their cholesterol as much as the folks who exercise 5 hours a week. So you can just exercise 1 hour. I'm not advocating that. I like more. More is better in this. But you don't have to exercise a tremendous amount to get the benefit either. So what we learned is that just intense exercise, and that's hard to do, but intense exercise for just 20 minutes, 3 days a week, can lower your cholesterol and improve your hyperglycemia, both risk factors for heart disease. We know with long-term exercise, we get benefits too. So in this study, we took people who have heart failure, and heart disease is a risk factor for heart failure. And they watched them over a year. And they took half the group and just had them do their regular activities, but the other half, they had them exercise just 2 times a week. Okay, not every day in the gym, just 2 times a week. And what they found is over the course of that year, the no exercise group, the folks who didn't exercise, were more than 2 times as likely to pass away in that time. And the endurance and quality of life increased about 18% in the folks who did exercise regularly. And there was about nearly 3 times as many hospitalizations in the no exercise group. So in this case, in people with heart failure, we find exercise for a year doubles your chance of survival, improves your endurance and quality of life, and decreases risks of hospitalizations by 66% over that year. Now, we're going to talk about stress. Okay, so depression and anxiety is a big deal, and it's an independent risk factor for heart disease too. Depression is, and so is anxiety. In this case, this was just a 10-day trial of exercise in people who have depression. So they took depressed patients, and they had them either do relaxing breathing exercises or placebo, or they had them exercise. This exercise in this case was just walking, right? They didn't have to do CrossFit or anything crazy. And they found that there was a 33% decrease in depression in the folks who exercised, compared to only 18% in the folks who did the placebo. And 65% of the exercisers actually said they felt happier. This is just a 10-day trial. So you can make an impact on your depression in a short amount of time. And in fact, a meta-analysis of multiple studies that looked at depression and exercise says that exercise is nearly as effective as the best medications we have at treating depression. Who likes to take pills? I don't. So, and it's not talked about much, but that's big, big. Anxiety. Anxiety, so in this study, they took people who do have an anxiety disorder and they're chronically ill, say you have heart disease or heart failure or other illnesses, and they had them exercise. In this case, over 3 to 12 weeks, they found that it improved their anxiety levels. When they looked at how much they exercised, if it was just exercise 10 to 30 minutes, they didn't do as well as people who exercised more than 30 minutes. So in this study, we learned that exercising more than 30 minutes is better for anxiety than just 10 to 30 minutes. And in fact, the people's anxiety improved as much as exercise helps with your fatigue. And we all know that if you exercise, your endurance builds up and your fatigue improves. So it's about as effective as that. Insomnia is another source of stress. If you're not sleeping, that's not healthy, and that can lead to problems. So what does exercise say about sleeping disorders? In this study, they took about 1,000 people from Great Britain. they were over the age of 65. And they followed them for 4 years. When they first started out, they found the folks who were already walking about 2.5 hours a week, they found that they had about 33% less likely to have insomnia. When they looked them up 4 years later, those same folks, and if they still maintained walking just 2.5 hours a week, they found that they were about 1/3 less likely to have difficulty falling asleep, and they were over 1/3 less likely to have difficulty staying asleep during the night, right? So we see with people who exercise, and in this case just walking 2.5 hours a week, that they actually can fall asleep easier and stay asleep more than 1/3 better than people who don't. And in this case was another study that looked at people who have insomnia that don't exercise, and they made them walk, again, 2.5 hours a week. Exercise 2.5 hours a week. It helped not only their insomnia, but also decreased their anxiety and their depression. I feel like that sometimes. Now here's a big one, chronic pain. So pain can lead to stress and can be an independent risk factor for heart disease as well. And chronic pain is just defined as pain that lasts more than 6 months, right? So we see that it's almost like a cycle, right, with chronic pain. People who have pain, they're less active. It hurts to move, so they don't want to move. They have less endurance. People who have pain are more likely to be depressed and anxious, right, which leads to stress. Worsened cognition, lower memory, lower attention. They're less active socially. They have more sleep disorders or insomnia. Increased risk of metabolic syndrome, high cholesterol, high sugar. Worsened immunity, higher risk of mortality from coronary artery disease, strokes, and peripheral vascular disease. It's a vicious cycle. People in pain are more likely to be inactive and on opiates, right? Painkillers. Low activity and opiates are each associated with obesity. Obesity is associated